So the paradigm shift is here to stay. So think about the terms wellness, primary prevention, wellness programs, and there are little things that you can do from the bottom up to help promote that. So what I want you to get out of the talk from me this morning: eat your blueberries. They're good in antioxidants for breakfast. For lunch, have a small portion of salmon, so 2-3 ounces, the size of the palm of your hand. And if you're so inclined, for dinner, it's okay to have a nice glass of red wine with dinner once in a while. Cardiologist orders, okay?
We have three segments of this natural selection concept with regard to wellness. One is the whiner. This is the company that complains about healthcare costs, complains about the health of their organization, but does the same thing they did last year or the year before. They do nothing. They are whiners, and they are food in the natural selection concept of wellness. The next one I call the apathetic participator. So they're kind of there, they're not really committed, they don't really have much leadership in this space. They do a few things, but really they're nothing. They're not a bunny rabbit, they're a jackalope, right? They're kind of a rabbit with horns. They're not really there, and they too probably are going to be food in this system. And the last one for the metaphor is the leader, is the lion, the king of the jungle, that leads, that does something, that communicates with their place of employment, with their communities, with their municipalities, with their regions, and with their country about the physical, financial, and mental aspects of real comprehensive health and wellness. And they will win. I found this cartoon, which I loved. It talks about this process. So it says, well, the weather was terrible, but the buffet was amazing. They had everything, right? And it's Noah's Ark, and there's lions there. So it fit my whole idea, right? I thought it was great. So what do lions do? And I'm going to show you, lions don't just talk the talk, they walk the walk. And so from our concept, what we see lions do in this space is do full health risk assessments for their employees. They find out about the trends and the cultures within their organization that are leading to their health and their healthcare costs. Lions also do biometric assessments. They pull blood and communicate the results. Dr. Dang's comments were exactly right. Just pulling results isn't enough. They have conversations, communication, and education with their employees about what their results mean and what they can do about it. And they do it regularly. My poor employees have been stuck with so many needles over the past 3 years. I'm sure most of them want to quit, but it's an important part of our culture. And it's an important part of the culture of the organizations we work with. They get outside that space. They talk about exercise prescription. They talk about what needs to be done. They do what they can to incentivize and track it and make it a meaningful conversation.
That has found itself into a thing called FedStrive, and FedStrive was expanded last year right here in River City. I had a little to do with that. I thought Kansas City would be a good place to do it, and FedStrive has been successful, and we have decreased obesity, we've increased the use of health risk assessments, and in Kansas City we have approximately 265 federal employees who voluntarily participate in the health risk appraisals downtown. It's not the only success in Kansas City. I'd be remiss if I didn't observe that a number of you have participated in wellness programs of your own. I still subscribe to the Kansas City Business Journal. It keeps me in touch with my hometown. And I read the article on March 8th that described the winners of the Healthiest Employees Awards, and Cerner, Children's Mercy, Lockton, St. Luke's, Truman Medical Center, Dunn, North Kansas City Hospital, all won awards, and my congratulations. And Kansas City Internal Medicine, by the way, won one of the awards. My congratulations to you, and my encouragement that you continue to pay attention to those things. As we look to the future, I'd just like to remind us that we have to be mindful of one simple truth. The policies that are written today will dictate how our children live tomorrow. The policies of the Affordable Care Act were written with that in mind, and under its authority, an additional 30 million people will have access to the health care system that they ought to have. Insurance companies will be required to spend a larger percentage of our money, 85 or 80% of our money, on the health care we receive, as opposed to spending on a variety of administrative overhead and the like. And the people who, through no fault of their own, have pre-existing conditions will no longer be denied coverage. All of these are things that we ought to be doing. The future is now. The future is in your hands. I'm impressed that the Chamber of Commerce and you all are engaging in this dialogue and these conversations. The Secretary and I and the department want to encourage you to do it. I thank you for doing the important things you're doing for your employees and for the people of the United States of America. Thank you.